Good evening, everyone, and welcome to Health Matters. I'm your host, Tibia. Today, we are diving into a fascinating intersection of technology and medicine that's transforming the way surgeries are performed. We are talking about robotic assisted surgery and, more specifically, how these advanced systems are changing the game in orthopedic procedures right here at ALTY Orthopedic Hospital. You know, the idea of robots in the operating theater might sound like something out of science fiction, but it's very much a reality today. I'm sure all of you would agree with me. These cutting edge technologies are helping surgeons achieve unmatched precision, improve patient outcomes, and reshape the future of surgical care. And to help us better understand this a remarkable advancement and its a real world impact on patients, I'm very delighted to welcome our guest today, Professor Dr. Azhar Merican, the consultant orthopedic hip and knee surgeon. Hi, Professor, how are you?
Hello, how are you doing?
I'm doing very good. How are you?
I'm fine, thanks.
All right. So before we dive into our discussion, could you please share a bit about yourself and your background with our viewers, our audience today?
Okay, so I'm a hip and knee surgeon, and I've been practicing for, I think, about 25 years. I started my medical practice in the University of Malaya Medical Center as a junior doctor back in 92. And then I did my surgical training, my orthopedic training there, and I continued to be a consultant in orthopedics in the year 1999. And I started doing knee replacement surgeries at that time in 2020. Since then, I went to do my fellowship in Australia for a year, in particularly in hip and knee surgery, and then coming back to the Malaysia, I did a stint also doing my PhD in Imperial College, which is more a research degree. Coming back to UM again, I was the head of the Division of Joint Reconstruction of the Hip and Knee Service, and then in the last 3 years, I've been with ALTY Orthopedic Hospital, and my primary
Very
work
passionate
is
about
hip and
hip
knee
and knee.
replacements.
Yeah, very passionate about hip and knee, I would say. So you have progressed in that industry itself. Very glad to know. All right, so jumping into our first question, could you share an overview of how a robotics is transforming the surgical procedures, particularly in orthopedics?
I think the robots in general in surgery has been around for quite some time, and maybe most of your viewers would have heard it for prostate surgery or gynecological surgery. And there, the robot is basically something which allows to do very minute surgery in small keyholes. The large movements of the surgeon's hands are translated in very small, small movements, and that allows increased dexterity and allows you to do very complicated things like remove a prostate to very keyhole surgeries. Now, in orthopedics, it's slightly different than that. It's been around actually for quite some years. I've just been looking through some of my slides, and I actually did the first orthopedic robot-assisted surgery back in 2012. And that was to do a
Wow,
partial knee replacement, which was to
right.
just change one side of the knee. And in the robot for the orthopedics, it's not so much smaller incisions, but the ability to more precisely tailor-make the patient's precision anatomy and also the soft tissue balancing of the knee for that particular patient. I mean, the
Right,
incision
right.
is not much smaller than a conventional surgery, but it's a much more sophisticated tool in which you use to balance the knee.
Correct, correct. Okay, very sophisticated. That's fascinating indeed. But now focusing on specifically the precision, like you mentioned, right? Something that's absolutely crucial in surgery, I'm sure. So, how does a robotic technology improve the precision and outcomes in joint replacement surgeries?
Okay, so yeah, there's always been a focus with the alignment of the knee because in the arthritic knee, as you may know, the knee looks bowed. That means the leg, the distance between the two knees widen, and you got this sort of like a cowboy shaped knees, and that causes the cartilage to wear out on the inner side of the knee, particularly. And those patients actually initially will start to wear out the inner side of the knee, and as the arthritis progress, it affects the whole knee. So when we were conventionally taught that that we had to realign the knee and make it completely neutral, that means completely straight. But now there's an increased realization that alignment by itself is not the primary focus. You got to get the knee straight, but you also got to get the soft tissues to be balanced, so that it's not too tight when you straighten your knee, not too tight when you flex your knee. And that's where the beauty of the robot is that you can make small tweaks in the alignment of the knee within the envelope of normality, and then that means that the knee is much more balanced. The knee transmits the weight from your hip down to your foot. So in a normal knee, your knee is quite well aligned, meaning the forces going on the inner side of the knee and the outer side of the knee is fairly equal. But as the arthritic knee progresses, you get more and more forces down the inner side of the knee. So one of the sort of goals of the surgery is to get the knee back straight. But at the same time, in the past, there was navigation equipment, for example, to get it very precise. But now we found that actually there's too much focus on just the alignment, and you need to balance the knee well, meaning that the amount of laxity that you get in the knee was optimum for the patient, meaning that if you made the knee too tight when the knee is straight, then the patient can't extend the knee, or you're too tight when they flex the knee, then they can't flex the knee. And conversely, the opposite is even worse. If you make it too loose, then the knee will be unstable and the patient will feel that it's very difficult to walk.
Like you mentioned, normal state, to bring it back to normal state, right? All right.
The concept of personalized alignment, meaning that not all of our patients are completely straight. And the ligaments have been used to that particular alignment for all these years. Of course, when the disease process sets in, they get pain coming from the joint. But to get them back to a so-called textbook straight knee may not be the right thing to do with that particular patient. So in that sense, the robot and the planning of the surgery allows you to tweak a little bit the alignment of the knee so that it's more compatible to the soft tissues. And in that way, because now you release the soft tissues less, there's a potential of making the surgery less painful, and the patient will be able to recover a lot quicker.
Right. Thank you for sharing that. And let's also talk about the practical side of things at ALTY Hospital. So what robotic systems or tools does ALTY currently use, and what advantages do they offer compared to the traditional methods that we have?
Okay, so I think there's quite a lot of nuances in terms that some surgeries actually maybe the robot hasn't quite evolved yet. And in particular, one of the surgeries which I do quite often, the partial knee replacement, which is just to restore the inner side of the knee. There, the ligaments of the patient is still quite intact, but it's the inner part of the knee has worn out. In this particular implant that I use, there is no robot invented yet. Maybe at some point in time there will be. But there, the balancing of the knee is actually done very much by feel. Because there the alignment is not as critical as the soft tissue balancing. And in that particular implant, there is no robot as yet. In total knee replacement, I think that's where the robot is very much, and it allows you a much more different level. It gives you a lot of feedback on the alignment and also the soft tissue balancing. So that's the particular robot that we have here in ALTY, the Velis robot, which is used for total knee replacements. But certainly we have other tools where we have navigation systems, intraoperative CT scans. Those primarily is used for navigation surgery in spine surgery, for example, or even in minimally invasive types of surgeries where we need to use navigation. In terms of recovery and pain, actually a lot of things a lot of moving parts go on in the overall recovery of the patient. And I think here, because we have, anesthetists which are very focused to doing orthopedic surgery, they know how to control pain and manage the post-operative pain or the post-operative possible complications which can happen. So we have a physician here and an anesthetist here, which really are quite integral in our team. And when you do something often enough, you get very good at it. So here, because we're very specialized, we have the so-called holistic approach to the whole orthopedic surgery and also its recovery. That's why we get results. And the robot is a tool, and it's certainly a good tool, but it
Yep.
can't take away from the personnel here, which are very dedicated to orthopedic care of the joint replacement patient.
Yeah, from our viewers' perspective, many of whom might be considering such procedures, I think this would be the, maybe Dr. also could share some key benefits, undergoing this robotic assisted surgery, as well as regarding, like you mentioned, any post-operative pain and mobility that you, might want to add on that you would like to share.
Yeah, I think, with regards to other robots like, the gynecological robot or the prostate robot, there is quite a quantum leap between the traditional open surgery and the keyhole surgery that you get with these, the ability that enables you to do this keyhole surgery. With orthopedic surgery, the incision actually is the same. But because potentially you require less releasing of the ligaments inside the knee, then the surgery, even though the incision may be the same, it's less invasive in that sense. But in terms of pain control and mobility, there are some patients actually who have had conventional surgery and actually do very well, provided that the surgeon's experienced enough to know how to handle that particular case. But the robot certainly, I think, will make a better surgeon even better still. But you can't really replace the experience of the surgeon nor the whole surgeon team.
All right. Definitely looking ahead, this field is definitely evolving rapidly. But what advancements or new robotic technologies can we expect to see ALTY in the coming years?
Yeah, I think they've been talked about incorporating robots in spine surgery, for example. There you want the accuracy of putting a screw into a particular part of the spine, so to straighten up the spine. And the spine is pretty, the potential dangers around the spine. You've got the nerves within the spinal canal and big vessels outside the vertebrae. And there, if you had technology to enable you to put it in very accurately, there are robots coming up to help you with that, to do that safely.
Okay. Anything else that we can expect at ALTY Hospital in the coming years?
We've had the robot actually for quite a number of years, different versions of the robot, but this current version is also image-free, meaning that we don't have to do very cumbersome scans before we can utilize the robot. But yeah, there are new technologies coming up, to do, say, partial knee replacements, hip replacements, and spine surgery.
All right. So, Professor, this has been an incredible, enlightening discussion. Thank you so much. Before we wrap up, is there any final message you'd like to share with our viewers about robotic surgery and the future of orthopedic care as well?
Yeah, I think some of the patients are certainly very sort of tech savvy, and the word robot conveys different meanings for different patients. Some of them feel that, okay, this is a very modern tool, and they are very subscribed to that belief. But some of the patients will feel, okay, this might be quite scary. They have some impression that it might be a sort of humanoid type Terminator robot, and we don't have control over it, and things may go wrong. But this is a semi-active robot. We actually hold the robot and we press the on and off button. So we execute it. It's just that the robot helps us to plan and also to hold the saw, if you like, so that we don't go off plan.
Right. Perfect. All right. With that, thank you so much, Professor, for sharing your expertise with us today and your insights into robotic surgery and its transformative impact on orthopedic care have been truly valuable. Thank you so much for joining us, Professor.
Okay,
and to our viewers, thank you so much. And to our viewers, thank you for joining us on this episode of Health Matters. We hope today's discussion have given you a better understanding of how robotic technology is enhancing surgical care and improving patient outcomes. All right. So for those interested in learning more about robotic assisted orthopedic surgery, ALTY Orthopedic Hospital continues to be at the forefront of these innovative treatments with their commitment to advance surgical technology and expert medical professionals like Professor, patients can definitely access the world-class care right here at home. All right. So you can find out more information about their services through their website at www.altyortho.com. All right. So remember, advances in medical technology like robotic surgery are making treatments safer and more precise and more effective than ever before. So if you're considering orthopedic surgery, don't hesitate to discuss these options with your healthcare provider. And I'm Tibia. This has been Health Matters. So join us next time as we continue exploring the innovations that are shaping the future of healthcare. Until then, take care of your health and goodbye.